Lymphoma is a type of cancer that originates in the lymphatic system, an essential part of the body's immune system that helps fight infections and diseases. The lymphatic system includes the lymph nodes, spleen, thymus gland, bone marrow, and a network of lymphatic vessels. In lymphoma, certain white blood cells called lymphocytes grow and multiply uncontrollably, forming tumors in the lymph nodes or other parts of the body. Types of lymphoma. Lymphoma is broadly categorized into two main types, Hodgkin lymphoma, HL, and non-Hodgkin lymphoma, NHL. Hodgkin lymphoma, HL. Hodgkin lymphoma is characterized by the presence of a specific abnormal cell known as the Reed-Sternberg cell. These are large, cancerous cells found in the lymph nodes of patients with HL. Hodgkin lymphoma is relatively rare but highly treatable, especially when detected early. It tends to spread in an orderly fashion from one group of lymph nodes to another. Non-Hodgkin lymphoma, NHL. Non-Hodgkin lymphoma includes a vast group of blood cancers that arise from lymphocytes but do not contain Reed-Sternberg cells. It is more common than Hodgkin lymphoma and includes many subtypes, which vary in how fast they grow and how they respond to treatment. Non-Hodgkin lymphomas are divided into B-cell lymphomas, the most common type, and T-cell lymphomas. Causes and risk factors. The exact cause of lymphoma is not completely understood, but several factors may increase a person's risk of developing the disease. Weakened immune system. People with immune system disorders, such as HIV/AIDS, or those who take immunosuppressive drugs after organ transplants, have a higher risk. Infections. Certain viral or bacterial infections are linked to lymphoma. For example, Epstein-Barr virus, EBV, and human T-cell leukemia virus, HTLV1, are associated with specific types of lymphoma. Age and gender. Hodgkin lymphoma is more common in young adults and older adults, while non-Hodgkin lymphoma occurs more often in people over 60. Men are generally at a slightly higher risk than women. Family history and genetic factors. A family history of lymphoma can increase the risk slightly. Exposure to chemicals or radiation. Prolonged exposure to certain pesticides, herbicides, or radiation may contribute to the development of lymphoma. Symptoms. The symptoms of lymphoma can vary depending on the type and location of the cancer, but some general signs include swollen lymph nodes in the neck, armpits, or groin that are painless. Unexplained weight loss. Persistent fatigue or weakness. Fever and night sweats. Itchy skin or rashes. Loss of appetite. Shortness of breath or chest pain, if lymph nodes in the chest are affected. These symptoms may resemble other less serious conditions, but when they persist or worsen, medical evaluation is crucial. Diagnosis. Diagnosing lymphoma involves several tests to determine its type, stage, and spread. The process typically includes physical examination. The doctor checks for swollen lymph nodes and signs of infection. Blood tests. These help assess the number of blood cells and detect abnormalities. Biopsy. A lymph node or bone marrow biopsy is performed to confirm the presence of lymphoma cells. Imaging tests. CT scans, PET scans, and MRI scans help determine the extent and location of the disease. Molecular and genetic testing. These tests help identify specific genetic changes in lymphoma cells that can guide treatment decisions. Stages of lymphoma. Lymphoma is classified into 4 stages, depending on how far it has spread. Stage I, involvement of one lymph node region or a single organ. Stage 2, 2 or more lymph node regions on the same side of the diaphragm are affected. Stage 3, lymph nodes on both sides of the diaphragm are involved. Stage 4, the disease has spread to distant organs such as the bone marrow, liver, or lungs. Treatment options. Treatment depends on the type, stage, and aggressiveness of the lymphoma, as well as the patient's age and overall health. Common treatments include chemotherapy, the use of drugs to kill rapidly dividing cancer cells. Radiation therapy, high-energy rays target and destroy cancer cells. Immunotherapy, Treatments such as monoclonal antibodies, example rituximab, help the immune system recognize and destroy lymphoma cells. Targeted therapy, these drugs focus on specific molecules or pathways involved in the cancer's growth. Stem cell transplant, replaces damaged bone marrow with healthy stem cells after intensive chemotherapy or radiation. Prognosis and prevention. The outlook for lymphoma patients has improved significantly due to advances in treatment. Hodgkin lymphoma, in particular, has a high cure rate, with more than 80% of patients achieving long-term remission. Non-Hodgkin lymphoma's prognosis varies depending on its type and stage, but many forms are also highly treatable. There are no guaranteed ways to prevent lymphoma, but maintaining a healthy immune system, avoiding exposure to harmful chemicals, and promptly treating infections can reduce the risk. Conclusion. Lymphoma is a complex but increasingly manageable disease. With early diagnosis, modern therapies, and personalized medicine, many patients achieve remission or full recovery. Continued research and awareness are key to improving survival rates and quality of life for those affected by this serious but treatable form of cancer.